Governor Pete Ricketts hit the road today to talk about the Department of Health and Human Services' new business plan. Channel 8 Eyewitness News reporter Abigail Wood joins us from the newsroom with more. Abigail?
Well, he'll be holding town hall meetings with local health and human services workers to catch them up on the plan. Today, they started in Lincoln.
You know the saying, if you fail to plan, you plan to fail. The Nebraska Department of Health and Human Services is hoping to avoid that this year with their first ever business plan. Wednesday was the official launch, and now the CEO of DHHS and Governor Ricketts are going town to take the plan to local health and human services workers.
They wanted a full continuum of vision of where we were headed over the next year. Not an after-the-fact plan, but they wanted to be aware of the plan going forward so they understood how they fit in for their services and the roles that they played.
The plan has 25 priorities and goals that the agency will focus on this coming year. Those goals include drug overdose prevention, shorter wait lists, and better economic assistance. Some practical goals are already well on their way. For example, there's a much shorter hold time when you call the Access Nebraska helpline.
In August of 2014, it was taking us nearly 24 minutes to answer the phone. And now for the last 9 months, we've been at or below our 5-minute target.
This plan has been on the table since Phillips was hired a year ago, and it's taken that long to put it together. She asked HHS teams across Nebraska for input.
We want it to be a useful tool. And so what is needed from the staff? What are they getting from it? What else can we add from it to make it useful for them?
Another big change, instead of keeping cases separated into groups like family, behavioral health, or public health like they are now, HHS says they want more coordination.
A lot of times those that we serve don't fit into one particular division. They may need one service in one area and another service in another area. And if we can bring that together, then we can serve that family.
Phillips says many DHHS teams wanted a more accessible and communicative department. She says this plan should help with that.
All right, thank you, Ab.